Hello and welcome to another episode of AMOI Unplugged, Exploring Diversity, a show that focuses on the efforts and milestones geared towards the diversification of our nation's economy. I am Chioma Ikejiani. Thank you for joining me. HIV and AIDS has a significant impact on economic growth by reducing human capital. But according to the Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu, Nigeria is well on track to attaining HIV epidemic control, even before the set global target, which is 2030. Don't go away, it's AMOI Unplugged, Exploring Diversity. You know, I have been so excited to do this interview from the very first time that I heard about you and I met you. Yeah. So thank you for coming on AMOI Unplugged. The first question I'm going to ask you is, what is your main job as the Chief Executive, the Director General of NACA?
NACA coordinates the multi-sectoral response against HIV. There are stakeholders. My main job is to coordinate the national response, to work with the stakeholders and make sure that HIV as an epidemic is controlled, and make sure that sustainability structures are put in place.
Where are we in terms of our efforts to control HIV in Nigeria? And when we say control, is it an epidemic? Would you say that HIV is an epidemic still in Nigeria? Or is it something that we've been able to get under control?
It is an epidemic in Nigeria. It is an epidemic globally. Mm-hmm. It is the longest, I think, epidemic that has stayed in history. HIV is, as an epidemic globally now, is 40 years. And in these 40 years, the global community has fought and is fighting the disease in several ways. And I'm glad and happy to say that that fight is yielding benefit. And it is working, even though we do not have a cure at the moment for HIV. But we have succeeded in reducing HIV to a chronic illness, like diabetes, hypertension, that you can live with, that you can continue to manage. The next step after reducing HIV to a chronic illness is to make sure we don't allow HIV to continue to spread among us, and that is the control. And that is the bridge we are headed to at the moment. We're about to control HIV.
I'm going to take you back to 2018 because for a lot of us, you know, as a Nigerian, I beat my chest because we conducted the largest survey, and it is the HIV/AIDS Indicator and Impact Survey, which is the NAIIS. As one of the key players in conducting the survey, can you give us a brief overview of why the survey was conducted, the findings, and why data is so critical in fighting AIDS in Nigeria?
Data are critical in fighting virtually every disease today, and they are critical also, you know, in whatever you do, because that is what informs your decision. In 2018, I was not in government, but we were given the work to do the survey for Nigeria, and I was part of it. In fact, I led it. What the issue was at the time has to do with the denominator. When we say the denominator, we're talking about how many people actually live with HIV in Nigeria.
So we didn't have that data back then?
We had, but the data was doubtful in the sense that the way we get to reach that conclusion was so limited. So limited in terms of size, was so limited in terms of accuracy because some of the tests we use are not as expanded and as detailed as the ones we use during the NICE. So when we came to do the NICE, we had a representation from every local government in Nigeria. We took samples from virtually every local government, including Chibok.
Wow.
Yeah, including LGS in Zamfara, because I could remember I was trailed by kidnappers coming out of Zamfara coming back to Sokoto. And it has to take a police roadblock or something, yeah, to just deter the kidnappers and scare them to make a U-turn. So that was the extent to which we were able to get to the grassroots, to make sure we collect data, and those data and samples, real-time data, because we see what is happening in the field. If you tell us you go and you've collected this data, we will know whether you've reached that location, because we're using Google Maps, yeah, to know that you've arrived at the location, to know that you've opened the household, to know that you have done the interview and you've collected the samples. We know. And we monitor here. So that was how detailed the survey was. And the main overarching goal, as I said then, was the denominator. We were thinking Nigeria has about 3.5 million people living with HIV/AIDS. But at the end of it, when we finished, that number changed to almost half. We came to know that actually it's not 3.5 million, it's about 2 million. Wow. And out of that 2 million, at that particular time, we realized we've already identified about 800,000 people, and we succeeded in putting them on medication, life-saving medication. And the interesting thing about the survey, it did not only tell us that we have an estimated number of about 2 million people thereabout living with HIV/AIDS in Nigeria, but it gave us the geographic locations.
Wow.
Yeah, where these people are staying or living in terms of where the epidemic is raging. And that was what informed us going after those locations to find out these people.
Wow.
So from that time to now, from 800,000, now we have 1.8 million. So you can see within 2 years, or just 2.5 years, we were able to do more than what we did, let's say, in the last 13 years before the survey, or 12 years before the survey.
So it's targeted?
It's targeted.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
You know, sitting down in your waiting room, I saw this beautiful picture of a mother, and she's breastfeeding her child. And sometimes we don't even think about women that are pregnant, that have the possibility of transmitting their HIV status unknown to them onto the baby. So I'd like to talk about that sector and how NACA is really working first to reach out to those individuals, those women, and what more do you feel that your agency needs to do to actually reduce that transmission?
Every pregnant woman that come to a facility and accept HIV testing and is found to be HIV positive, we have 100% success of protecting the baby, preventing mother-to-child transmission of HIV. We are 100% in terms of our success. However, for pregnant women that don't show up at the facilities for delivery, at facilities for antenatal care services, our access to them is limited. What we are doing now is to map out locations where the services are given all over the country. After this mapping, we'll now be able to spread out the services more and go into the community. This is
like
the
an
second part.
integrated, like something. So you want to do something integrated with your primary health care provider.
Exactly, with primary health care provider, with traditional birth attendants, with the nurse or the midwife in the community, with religious places of worship. This strategy that we're about to adopt will give us access to more pregnant women, because now we are going to the community level, the household, whatever is convenient for pregnant women to be tested. We want to make sure we test as many pregnant women as possible this year.
So if someone is watching this, is there a national number, a federal number that they can call to ask questions?
Everyone who needs more information about HIV services, either prevention services or treatment services, is welcome to call our call center at 6222 from 8 a.m. Yeah, from 8 a.m. To up to about 5.
Did you come up with the 6222?
NACA came up with the 6222 together with telecoms. And this is one thing that the telecoms are doing to support, HIV prevention in the country, and also HIV services generally. They give us this service free of charge. We don't pay.
Wow.
And also the caller does not pay. It's a toll free.
Oh, that's amazing.
Yeah.
Talk to me about your collaborative efforts in fighting HIV.
If I can say the fight against HIV is one of the most organized and successful multi-sectoral collaboration that is existing. And the Nigerian HIV response is one of the most robust in Africa, if not globally in the world. From Geneva to Washington, now the talk about Nigeria is quite different from what we were seeing before, maybe 5-6 years back. Now everyone takes Nigeria serious, and the global community learn about Nigeria's HIV response to apply to other countries. Now I can tell you, I have had envoys from some African countries coming to NACA to discuss HIV response and to see how we collaborate with their agencies in their countries, to help more their country HIV response. So Nigeria has done tremendously well in terms of coordinating the multi-sectoral response for HIV, in terms of managing the resources that are made available. These resources are transparently and openly managed.
So we know that these funding partners will not last forever. So what is NACA doing to maintain sustainability, even if the Global Fund disappears tomorrow? How are we able to, still do the things that we're doing if the global partners leave? Are we putting things in place?
Money from the global partners is called external funding. The money we generate within the country whether that money comes from government, the federal, the state government, or from private sector, is called local resource mobilization. So we've gone into local resource mobilization. And recently, we launched the HIV Trust Fund of Nigeria. The President, His Excellency, the President, Muhammad Buhari, launched that trust fund. And what that will help with in the next 5 years is this mother-to-child transmission. And we want to make sure we have enough resources to cover every pregnant woman in the country, which is a gap actually in our current programming. And then as we go further, we see how we bring the state government into the equation where they take their rightful place and now take ownership of their epidemic. We will still figure out how to make medication available to virtually every center from the center. Every location where services are given from the center, and also make testing kits available from the center. But the state should at least keep their clinics running. They should at least pay their staff salaries and allowances, and they should make money available for program coordination in terms of the vehicle that their staff use to go around, and the little money they carry out activity with civil society organizations at the grassroots. The state should be able to provide that. So with that said, we're looking, to establish a structure where even if the implementing partners or external donation, dwindles and it's no longer as it was before, we should be able, using increased efficiency that we've established at the moment, which we call alignment, to be able to absorb and close those gaps, absorb the deficit and close the gap, that is being generated because the external fund is no longer there.
Okay, we'll be right back with AMOI Unplugged, exploring diversity.
Sister, where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Just before we went on commercial, I wanted you to talk about some of the key milestones that have been accomplished under President Muhammadu Buhari's legacy.
The whole aim of HIV epidemic control is to make sure virtually everyone, close to 100% of people that live with the virus are identified and they are placed on life-saving medication to keep this virus in them and deny the virus opportunity to spread. That has never been successful in the history of HIV response in Nigeria than over the last few years in the administration of President Muhammadu Buhari. It was, again, that has not been seen in the past and has not been seen actually in the history of HIV response, even globally, you can say it. What we did during the COVID-19 lockdown from 2019 to 2000, In that period, we were able to identify and link to treatment about 340,000 individuals that were not on treatment before, or were not in our system that we can see. And between 2020 to 2021, we've identified over 400,000. Wow. So in between this 2-year period, we've identified almost 800,000 people and placing them on treatment. If you go back from 2019 to 2015, in that period, we have also made a modest gain of identifying and adding about 300,000 individuals. But before 2015, our gain in a year, in terms of our ability to identify and place on treatment, is in the range of 50 to 60,000 persons every year.
Tripled.
So this was made possible, during this administration. And it is during this administration we did that survey that you're talking about. And after the survey, it is still in this administration that we were able to do the targeting. If you like, they call point and kill. We were able to do the targeting to saturate communities where we get the knowledge that this is where HIV is breeding, and HIV is breeding fast in those communities. Saturate, identify people that are spreading the virus, make sure we deny the virus the opportunity to spread by placing these people on treatment. And this sent a message to the donor community, to the global community, that government political support for HIV is unparalleled. The Nigerian government is serious, is supporting HIV with every tool that is required to end AIDS in Nigeria, and that is working. And because of that, the stakeholders also now feel encouraged to add more money to the fight against HIV. Nigeria has the largest allocation ever from Global Fund during this administration.
You're kidding me.
And it also has the largest allocation from PEPFAR during this administration. It is all because of one thing: the confidence and the trust they have in the administration and the seriousness they have seen in the leadership, to do the needful. And we're very thankful to His Excellency, the President of Nigeria, for leading this, for making resources available, and for giving us support whenever we run to him looking for support. So another thing he did that is welcomed by the international community was the waiver he gave to NACA to procure commodities at the manufacturer's rate.
Wow.
Yes, and that has enabled us, to fulfill the commitment he has made, with the resources that are made available from Federal Ministry of Finance and National Assembly. That resources is enabling us to fulfill the President's commitment without any default.
Okay,
yes.
One last question. I know you have a list moving forward. What is your list between now and 2023? What are some of the things that you want to get done?
One, get the epidemic under control. And we're going to do that either this year or early next year. That we should be able to do. Two, after the epidemic is controlled, work for 2 more additional years to provide sustainability structures in the country to make sure that that control is sustained. These are the to-do list. So once we are able to do that, I think Nigeria will never lag behind other countries in terms of controlling HIV. Other countries lag behind because of COVID-19. We were never affected in terms of getting to go behind because of COVID-19. It was a plus. We did the opposite. We go ahead because of COVID-19. So with this momentum, we want to make sure that we take advantage of it, we control the epidemic, and we quickly provide sustainable structures, to sustain the control, and look at global community and tell the global community, yes, Nigeria has done it.
Thank you so much. It's a pleasure.
My pleasure, and thank you.
Need I say more? I'm sure you've enjoyed that interview. Till I come your way again, let's continue the conversation on my social media platforms. I am Chioma Ikejiani. Bye-bye and stay safe.